boy Marksburg, Slim, coming live from Charlotte, North Carolina.
Hey, this is Coach Beatty Waddell, West Mac High School.
I'm Doug Rashid. I'm a Grammy-nominated record producer.
Hey, I'm LaKoya McClain. I used to be known as inmate 1570847.
Hey, my name is Lydia. I'm a social injustice activist.
Hey, it's Danielle E. Brown, songwriter and artist, and we're rocking with Grandosiá TV.
Hi, I'm Dr. Laddeus Sutton. I'm rocking with Grandosiá TV.
Welcome back to Grandosiá TV, where we have Dr. Laddeus Sutton here with us today. And today we're going to talk about the heart. We're going to talk about why does the heart matter to us in our bodies. But before we get into this conversation, before we talk to the doctor, what I want you to do is subscribe, like, hit the notification bell, so when we go live, you get all the update information, so you'll be staying in tune with the TV show. With that being said, Dr. Sutton, how you doing?
I'm doing very well today.
So today, I want to bring you on. I want to talk about what is the heart. Why does the heart matter the most in our body?
As adults in the United States, cardiovascular health is very important, simply because of all the connections it has in terms of how the heart affects your lungs, your blood vessels, your brain, the strength of your muscles. All of that's influenced by the heart and the cardiovascular system in general.
So my next question is, with us being people of color, with us being African Americans, why do it seem like we battle the most with heart disease, blood pressure? I want to say strokes come along with that with the heart as well. Why do we battle so much with that stuff when it comes to our heart?
That's a very good question. As African Americans, we are not genetically or biologically great at risk for cardiovascular disease, but many of the social factors play into it, I think. Mm-hmm. If you look around many of the African American neighborhoods, for example, there's food deserts where, and what I mean by that, there's places that you can get food, but it's food that's maybe less healthy, foods that tend to be high in saturated fats, high in carbohydrates, things that inherently influences your cardiovascular health. So that's one thing. Secondly, the communities that we live in, many times they're very high dense communities, and we've seen that this past year, even with the coronavirus pandemic, that puts at greater risk of being infected with certain illnesses like viral illnesses and all of those things that play into it. And then just the whole health disparity works against us. Access to health care, being poorly insured, things of that sort, that works against us. So I think there are a lot of social factors that play into the ultimate increased risk of cardiovascular health and the sickness and mortality that we suffer from this.
Now, with a thing like cigarettes, with a thing like alcohol, do that make us more susceptible to heart problems in the long run?
Very good question. Yes. There are many factors, the so-called risk factors for cardiovascular disease that works against us. And I always say my formula is that which the American Heart Association, a formula it came out with, it's been about 10 plus years now, and it's called My Life's Simple 7. Mm-hmm. My Life's Simple 7 is a checklist that we can all use to see where do we stand in terms of our risk for cardiovascular disease. And when you talk about those 7 items, number 1, get active, stay active. preferably do moderate physical exercise, at least 30 minutes, 5 times a week, or a total 150 minutes a week is the goal. Okay. Number 2, eat right. And that refers to eating a diet that's more concentrated with fruits and vegetables, and you're staying away from things that are high saturated fats, high in cholesterol, high in sodium. Number 3, manage blood pressure. As African Americans, blood pressure is very prevalent in our community, but managing it, making sure that you know your numbers, that you're talking with your healthcare provider about the right medications to stay on the appropriate medicines. If you feel good, you still may need to be on the medicines. Gotcha. Number 4, managing blood sugar. Diabetes, or this so-called pre-diabetes, is very prevalent in African American community, and we need to know what our numbers are, what our fasting blood sugar is when we get our yearly blood work, and to manage that. Number 5 would be manage cholesterol, which is also a risk factor for cardiovascular disease. Know your number. Know what your last cholesterol was when you went to see your healthcare provider. Number 6 would be, if you smoke, stop smoking, avoid tobacco. That's very important, to avoid tobacco products. And then number 7 is manage weight, to set a goal for where you want to be and to manage your weight. So that encompasses the 7 checklist points. And I think all of us, we need to do a self-check on those items from time to time.
So how much of a role do other illnesses like diabetes play with the heart, or any other thing that may happen? I know some people may have sexual transmitted diseases. Do that play an issue with the heart? Do anything that's foreign to our body play a big issue towards our heart that cannot have us living heart healthy?
Yes, I think that's a very good question. First of all, many of the major illnesses like hypertension, of course, diabetes, high cholesterol, even many of the lung diseases, asthma, obesity, they do impact cardiovascular health, and they also impact how quickly we recover when we have cardiovascular events, how quickly we recover from these events. I think, again, controlling those factors is important in terms of long-term health. There are other things, infectious diseases do impact the cardiovascular status, and it does so mostly by when things come into our body that are foreign to us, the body's response is to turn on your so-called sympathetic activation, whether it is your adrenaline system. So if the body is unique in that if something is going wrong, if we've been exposed to a foreign item, the body responds. The heart rate is faster, the blood pressure is faster, and of course, when those factors play into it, it puts the person at more at risk for having illnesses attributable to the cardiovascular system. And we've seen that again in this last year with the coronavirus pandemic. Again, a virus that was foreign to the body. We've seen so many patients that when they come in, they have this sympathetic activation. Their heart rate is fast, their blood pressure is fast, their respiratory rates are fast, and that puts more stress on the heart. And when we look at injury to the heart, that's one of the factors that play into it. And then there are other factors, increased inflammatory conditions, and so-called cytokine storm and things like that play into it, and then increase blood clotting from a foreign illness, like, for example, coronavirus, that puts the whole cardiovascular system at risk.
Now, I'm going to come back to the COVID question here in a minute, but I just thought about my brother who passed away 3 years ago from a heart attack. And one thing that they said was fluid builds up and it choked his heart. How does that happen? How does a heart attack happen? What is things that takes place there, but what are things that we can do to prevent that from taking place? If you feel tightness in your chest, what can we do to prevent that, to try to get us to the hospital to have a chance to survive?
I think that's an excellent question. That's a question that, as adults, we've all faced at some point. We feel something that does not feel right, something that feels uncomfortable. And the signs of cardiovascular disease a lot of times may not follow what the textbooks say they will follow. In that if you feel something that does not feel right, something that's uncomfortable, whether it be discomfort in your chest, it may not be chest pain per se, but it may be something that feels discomforting to you, or either a change in your physical status. Whereas if you could get out, work in the yard for 2 hours without getting tired, and now you can only work for 15, 30 minutes and you're tired and fatigued, things that have changed in your body. So I think paying close attention to your body is important. So knowing the signs, the potential signs of a heart attack are important. And again, those are discomfort, chest discomfort. Shortness of breath can be the equivalent to chest discomfort. Reduction in physical exercise tolerance or increased fatigue can be a manifestation of heart disease. So those are things you need, I think, are important to look at. In terms of how most heart attacks or most acute coronary syndromes occur today in the United States, most times it's either from a plaque rupture. A blood vessel has plaque already, and the plaque ruptures, and it causes blood clotting into a blood vessel, and that sets the stage for a heart attack. There are other causes for heart attacks, but that's one of the most primary things that we see. And in the United States nowadays, most hospitals have capability to take the person to the cardiac catheterization lab 24/7 and correct that, do mechanical correction of that blockage, of that plaque, and open up an artery. Again, I say there are other causes for heart attacks, and sometimes it can be uncontrolled blood pressure. The uncontrolled blood pressure puts tension on the heart muscle to cause a heart attack. There are other reasons. Patients that come in with lung disease or pulmonary issues to the point that they may require mechanical ventilation or either high flow oxygen. Sometimes the stress of the lungs can put tension on the heart, and we see signs that there's been heart injury. So there are other factors that can cause a heart attack that we see quite commonly in this day and time. But I think knowing the signs of heart disease and knowing when you feel something that feels different or some discomfort to the body that's not your usual state, I think it's best to pay close attention to that.
Now, you said something a few minutes ago about most hospitals have the ability for the heart lab to stay open.
Yes.
With that being said, do you think compared to 40s, 50s, 60s, 70s, 80s, even early 90s, it's a better chance of recovery if they get to you sooner than it was then?
Right. Cardiovascular sickness is predicated many times on how quickly we recognize what's going on and how quickly we can do in terms of addressing the issue. It's often said the heart is time is muscle. And what I mean by that, the time that's spent from getting a person from their home to a medical center where they can get prompt attention, and if they recognize they're having acute coronary syndrome, get them to the cardiac catheterization lab and open up that artery, then you do save some long-term permanent damage to the heart muscle. So time is critical, not just for heart attacks, but also for strokes too. I've seen many patients that felt they had stroke-like symptoms, but they stayed at home for a day or two. So I think if you feel something don't feel right and you think you're having a heart attack, I prefer you not to be in my office 2-3 days later saying that. I'd like to say that you tell me that at least you were seen in a medical facility and they excluded that you did not have it, rather than say that you thought you had it, but you were going to wait and see me 3 days later in the office for both heart attacks or strokes, because again, time is muscle. Time is also important to the brain in terms of addressing that issue as soon as possible to minimize long-term damage.
Now, my next question would be, when March 12th, 2020 came and we learned about this thing called COVID-19 or the coronavirus, what did you see in the field that said, man, this can really affect the heart, or this disease of COVID is really bad for my patients that may have heart issues, blood pressure issues? What did you see from this that affects the heart from COVID-19?
That too, that's a very good question. And as a nation, as a world, this past year has been one of the greatest challenges, at least that I've seen in healthcare. But the things that we've seen is that when patients come in and they've had already pre-existing cardiovascular illnesses, and again, if they've had hypertension or those risk factors for cardiovascular illness, hypertension, diabetes, cholesterol, obesity, and also we've seen even patients that have lung disease like asthma, when they come in with the coronavirus infection, they're sicker, they tend to suffer more, and their recovery is a little delayed due to those underlying illnesses. Patients that have had previous congestive heart failure, for example, they tend to have more worsening episodes of heart failure, and that's what we've seen. A lot of patients that have come in with the coronavirus, when they test the blood levels, they see that there's been muscle injury. And again, a lot of that's due to that when the body feels something foreign to itself, you turn on your sympathetic activation, you turn on your adrenaline system. And we've known as a kid, when we were afraid of something, or if something didn't seem right, we turn on our so-called adrenaline system, and we get out of the way. You know, if you see a car coming in your direction, you move out the way. The heart sees that. When the coronavirus or any major illnesses, the heart sees it that way. It turns on the sympathetic system, and you see increased heart rates, increased blood pressures, increased respiratory status, and those things, unfortunately, also can cause muscle injury to the heart. That's one thing that we've seen. The other, on the flip side, we've seen, unfortunately, because we've been asked to shelter down, stay away, we've seen patients that have had heart episodes or have had stroke-like symptoms, and they opted not to come to the hospital because of the fear or being told that they need to stay in. And unfortunately, many of these patients we're seeing coming with delayed presentations, and they too are a challenge to treat because sometimes they've suffered injury to the heart or they've suffered injury to their whole cardiovascular system, and we're playing catch up.
Now, is it anything that we can do? I know you just said heart rate a couple of times. Is it anything that we can do? I know exercise is probably the main thing, that to get our heart rate to calm back down and calm down, or once your heart rate is up, is up. I mean, is there any things for that?
Yes, I think in terms of cardiovascular fitness, I think staying active, being as active as possible. And I tell patients, when I talk about being active, I think you find what fits you best, because some patients will come and see me and say, well, yeah, I have orthopedic problems. I can't exercise on a treadmill, or I can't do this, or I can't do that. But I think you tailor your exercise to fit your body style. But I think staying active, even if you have to do floor there are certain floor exercises that you can do, or exercise you can do in a recombinant position if you have problems standing. But to stay active is important, because yes, that does affect your resting heart rate, your resting blood pressure. And if that is a still existing problem, there are medications for patients that have heart rates that are at rest or faster than we expect. There are medications that we can give to control that. But I think the first step is staying active, being as active as possible, doing all the things that you can do to make your cardiovascular status as best as you can is most important.
Well, this is a lot of great information. I really do hope that people take this information and apply it to their heart. I know I will. I know one thing I have to do is definitely eat better. 'Cause my food choices some days will be awful. But I will ask this question, and it's probably one of my last ones I ask. I'm one of these young people who don't like sleeping. I'm up all the time working, trying to get ahead in life. Where do sleep play on that scale when it comes to the heart?
I think that is an excellent question because I mentioned the American Heart Association, their formula or their algorithm some years ago, about 10 years ago, that is my simple 7 checklist. I personally think that if they had to add item number 8 or item number 9, I think sleep would have been the 8th item because sleep is important. Sleep has very impactful effects on the cardiovascular system. So sleep is important. And I think most sleep specialists would say try to get the same amount of sleep each night. The goal is to try to get at least 7 hours of sleep, try to go to bed at the same time. But sleep is very important. And I think if there was another item number 9 would have been the so-called learn how to control your personal stress. You know, if you're a type A personality, to try to minimize or to try to lessen that driven type of personality. But those are the 2 additional factors. If they had to add a 8th and a 9th item, I personally think would have made the list. I want to say one other thing. I always say one last comment. This is from Dr. Martin Luther King almost 55 years ago when he addressed a health conference in 1966. And this is quote, "Of all the forms of inequality, injustice in health is the most shocking and inhumane." And when we talk about this whole health disparity that we see in African American, I think that statement that he made 55 years ago is still applicable today, that we still got to fight this disparity in health care and the social factors that play into people that look like me in terms of health care and just general health, long-term health care.
Well, we thank you for that. Well, since you said that, I got a question for you then. I do have one more question. I know we ended the show, but we're going to put this in as a bonus. What can we do to steer our young people, men or women, female or male, into going in, who look like us, to go into being a doctor to where we can make sure some of that inequality in the medical field is even out now?
I think that is very important because the numbers of African Americans entering medical school or entering the healthcare field still lags behind the percentage of African Americans here in the United States. So I think the role is mentorship is important, to encourage the science, the technology, those areas, to encourage those areas of science, technology, engineering. I think that's important, and also finding the right role models is important, and to continue to encourage, because if you can encourage one, maybe they can encourage another one, and I think that's important. The other thing that I sometimes see is many of the students will get discouraged because they have an exam or they have a course, they have a struggle with the course, but we all have struggled along this journey with courses, particularly in medical school or internship and residency. So I think encouraging, just because if maybe one course didn't turn out the way that you wanted to, that there are going to be many more opportunities with this. But I think it is important. That certainly is a part of the whole, to try to correct and level the playing field in terms of healthcare disparities.
Well, Dr. Sutton, man, we appreciate you coming on the show today. We appreciate you dropping that knowledge that you dropped with us today, this wisdom that we can soak up and do something with. But before we let you go, I'm going to tell the people to make sure they subscribe, like, hit the notification bell, so when we go live, you get all the new up-to-date videos. And we'd like to say thank you, sir. We salute you for everything that you do in the healthcare field. You are the true hero out here in America.